This medication is used to control and prevent bleeding episodes in people with low levels of factor VIII, hemophilia A. It is also used in these patients before surgery to prevent bleeding. People with low factor VIII levels are at risk for bleeding longer after an injury/surgery and for bleeding inside the body, especially into the joints and muscles. This product contains a man-made form of factor VIII, also called antihemophilic factor. This product is used to temporarily replace the missing factor VIII, a protein, clotting factor, that is normally in the blood, so that the blood can clot and the bleeding can stop. When using this medication, it will be injected into a vein as instructed by your doctor. Depending on your dosage and how your body responds, it may need to be administered more slowly over a longer period of time. After receiving this medication for the first time in a hemophilia treatment center or hospital, some patients may be able to administer it to themselves at home. If your doctor allows you to do this, it's important to read the patient information leaflet from your pharmacist before starting and each time you get a refill. You should also learn how to properly prepare and use the medication, as well as how to safely store and dispose of needles and medical supplies. If you have any questions about this process, be sure to ask your healthcare professional. If the medication and the solution used to mix it were refrigerated, it's important to bring both to room temperature before combining them. Once the solution is added to the powder, gently swirl the mixture to completely dissolve the powder, do not shake it. Before using the product, visually inspect it for particles or discoloration. If you notice either of these, do not use the liquid. Use it right away according to the product instructions. The dosage of this medication will depend on your medical condition, age, weight, blood test results, and how you respond to treatment. It's important to closely follow your doctor's instructions in this regard. If your condition does not improve or worsens, be sure to inform your doctor. Some possible side effects of antihemophilic factor, Recomb, solution, Reconstituted, Recon Soln, include flushing of the face, headache, nausea, and fast heartbeat. These can be lessened by giving the medication more slowly. You may also experience burning, redness, or irritation at the injection site, fever, and chills. If any of these effects last or get worse, it's important to tell your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. While a very serious allergic reaction to this drug is rare, it's important to seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, trouble breathing, and chest discomfort/tightness. This is not a complete list of possible side effects, so if you notice any other effects not listed above, it's important to contact your doctor or pharmacist. Before starting this medication, make sure to inform your doctor or pharmacist if you are allergic to any antihemophilic factor, factor VIII, products, or if you have any other allergies. Some brands may also contain polyethylene glycol, PEG, or inactive ingredients that can cause allergic reactions. It's important to discuss this with your pharmacist for more details. Inform your doctor or pharmacist about your medical history, especially if you have a certain type of hemophilia, congenital hemophilia A with inhibitors. Some manufacturers recommend monitoring your heartbeat during treatment. If your heart starts to beat faster, it is recommended to administer the medication more slowly or temporarily stop the infusion until your heart rate returns to normal. Consult your doctor for more details. If you are pregnant, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. It is not known if this drug passes into breast milk, so it's important to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions when taking antihemophilic factor, Recomb, solution, Reconstituted, Recon Soln. Certain medications may affect how this solution works or increase the risk of serious side effects. Be sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this information with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of antihemophilic factor, Recomb, solution, Reconstituted, Recon Soln. If you suspect an overdose or experience serious symptoms such as passing out or trouble breathing, seek immediate medical attention. In the U.S., call your local poison control center at 1-800-222-1222. In Canada, contact a provincial poison control center. It's important not to share this medication with others. Your doctor may also require you to undergo lab tests, such as factor VIII levels, while you are using this medication. Make sure to keep all your medical and lab appointments and consult your doctor for more details. Remember to always follow the dosing schedule prescribed by your doctor. If you happen to miss a dose, it's important to consult with your doctor or pharmacist to establish a new dosing schedule. Under no circumstances should you double the dose to make up for a missed one. When you store this medication, make sure to follow the instructions from the manufacturer. If you have any questions, ask your pharmacist. Keep the product away from freezing and protect it from light. After mixing, use the product within the time frame stated in the manufacturer's instructions and throw away any unused portion. Keep all medications away from children and pets. When you no longer need this product or it is expired, make sure to properly discard it. Do not flush it down the toilet or pour it into a drain unless instructed to do so. You can consult your pharmacist or local waste disposal company for more information on how to dispose of it. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.